So our second presenter for this afternoon is Dr. Portia, or is attorney Portia Reddick White. She is Vice President for Strategic Partnerships, Campaign for Tobacco-Free Kids, Washington, D.C. As Vice President of Strategic Partnership at the Campaign for Tobacco-Free Kids, Portia Reddick White leads programs to build, cultivate, and sustain relationships with organizations that represent communities disproportionately impacted by tobacco use. As a leader in strategy, outreach, and political engagement, she has led efforts previously with the National Education Association, Majority Leader Harry Reid, Transport Workers Union of America, and 2016 Democratic National Convention and AARP, including roles as speakers, writer, organizer, and activist. Portia Reddick White. Thank you, Portia.
Thank you. Hello, I am Portia Reddick White, the Vice President of Strategic Partnerships at Tobacco Free Kids, and I'm really glad to be with you today during your National Black Nurses Association Day on Capitol Hill. I thank your president, Dr. Martha Dawson, Dr. Millicent Gorham, your executive director, and Dr. Claudia Craig Byers, your co-chair of your Health Policy Committee, for the opportunity to partner with you, support you, and work with you to elevate the issue of tobacco use and the toll it has on tobacco equity, on health equity. So the problem is that for 50 years and more, the tobacco industry has deliberately targeted the Black community with menthol cigarettes, which, as you know, are even more addictive and harder to quit than regular cigarettes. They've profited enormously while disproportionately destroying Black lives and health. The tobacco industry has targeted Black Americans with pervasive marketing on menthol cigarettes in so many ways. They've sponsored community and music events, promoted their products in magazine advertising and retail promotions. And on the surface, these advertisements suggest somewhat positive images, actually, of Black people in media and highlight the beauty of Black culture and music. But not all representation comes from pure intention. These predatory marketing schemes have worked all too well. And in the 50s, less than 10% of Black smokers use menthol cigarettes. That number today is much higher. Just look at these ads. See the wording: coolness, cold, easy, fresh. Why use this wording? Well, that's because menthol is cool. It masks the harshness of smoking in your throat, and incidentally makes it easy to smoke and makes cigarettes even that more addictive. Today, about 85% of Black smokers smoke menthol compared to 29% of white smokers. And over half of youth smokers aged 12 to 17 use menthol cigarettes compared to less than 1/3 of adults ages 26 plus. In fact, over half of African American Black youth smokers use menthol cigarettes. And it's easy to see how and why, looking at this with the tobacco retailers, they're prevalent in African American Black communities. As this slide shows, two examples of that: the left, African American community in St. Louis County, Missouri, and the right, Durham County, North Carolina. To this day, menthol cigarettes continue to be heavily advertised, widely available, and priced cheaper in Black communities, which makes it especially appealing to a price-sensitive youth. I think if we look and take a deeper look, actually, we might even find that there are parallels that could be made in these same communities with alcohol marketing and liquor store locations, as well as food deserts without healthy food options. It's the era of the 2020s where everything is on the internet and at a point where we all use social media to communicate. The tobacco industry has kept up with the times, and they also use social media platforms like Instagram to reach Black youth. They employ the same strategies that were used in print magazines years ago to make using tobacco products appear to be fun, a social activity, right behind the banner though, or right beneath that banner. about its life-altering health impacts. The depiction of young African American men and women in these ads who are role models of the day, they bring the swag, the style, the culture, and everything in the mix. We see that the tobacco industry, as they have in years before with cigarettes, they're using this mean as well to target Black communities and youth with marketing for their cheap flavored cigars, which can be smoked like cigarettes. These products are sold in a wide assortment of kid-friendly flavors and can be as cheap as 99 cents, making them highly appealing to youth. In 2020, 9% of all Black high school students smoked cigars, compared to 5% of all high school students. This indicates that more than likely, this marketing to Black youth through social media, the tobacco industry marketing scheme of the day, as well as of yesterday, it is working. So we have to do our best to counteract this marketing to our community, because we know that tobacco use has a profound impact on African Americans' health. Tobacco use is the #1 cause of preventable death among Black Americans, claiming 45,000 lives each year. Let's look at this quote from the U.S. Center for Disease Control and Prevention. Quote, "Tobacco use is a major contributor to the 3 leading causes of death among African Americans: heart disease, cancer, and stroke. Diabetes is the 4th leading cause of death among African Americans. The risk of developing diabetes is 30 to 40% higher for cigarette smokers than non-smokers," end quote. Further, there is growing evidence that smoking and other tobacco use can increase risk for COVID-19, which, as we all know, has so disproportionately impacted Black Americans. Just as the previous speaker just talked about the ability of getting some type of aid and moving toward the inoculations, we have to take considerable pause to make sure that we're doing our part on the other side to make sure that we end the smoking epidemic as well. Lung cancer is the leading cause of cancer deaths in Black community. While it is promising that rates of lung and bronchus cancer among Black people are steadily declining, as you can see, there is still disparity between Black and white males. African American Black men start to smoke later and smoke fewer cigarettes a day, but they have higher incident rates and higher death rates for lung cancer. Why? Excuse me. Probably because they quit at lower rates and because most smoke menthol cigarettes, which of course, as I've stated earlier, it's more addictive and it's associated also with a reduced cessation rate. Today, the tobacco industry is following its menthol playbook by addicting a new generation of kids with e-cigarettes and appealing flavors like bubblegum, mint, mango, and of course, menthol. They continue to prey on our children to maximize profits and ensure the survival of that tobacco industry. While African American youth smoke cigarettes at a much lower rate than their white Hispanic peers, cigars, which are priced cheaper, like I said, often 2 for 99 cents, are popular among African American youth. Let's look at this chart. Looking at this chart, you've got your 12.3% of young African Americans who are much higher users at that rate than their counterparts of the Hispanic as well as the white youth. So it is an issue within our African American communities of smoking cigars. It's at a high rate. We know that COVID-19 attacks the lungs, and there is evidence that smoking increases the risk for respiratory infections. It weakens the immune system and is a major cause of a number of chronic health conditions, such as COPD, asthma, heart disease, diabetes. And yes, there's a growing evidence that vaping can also harm lung health. Right before COVID-19, you'll probably remember there was this prevalence in our society where there was a focus on the ills of vaping and the deaths and sicknesses that were occurring. With COVID-19, we really don't hear much about that right now, right? But we do know that vaping is not good for young or old lungs. So Dr. Nora Volkow, director of the U.S. National Institute of Drug Abuse, stated it this way, quote, "Because it attacks the lungs, the coronavirus that causes COVID-19 could be an especially serious threat to those who smoke tobacco or marijuana or vape," end quote. And as we know, COVID-19 has especially hit communities that already are experiencing these high rates of inequity and disparity. From the words and thoughts of Dr. Martin Luther King, we follow with a focus to move in the right direction to change the dynamics of injustice and inequality. Of course, he said, quote, "Of all the forms of inequality, injustice in health is the most shocking and the most inhuman," end quote. So as a follow-up, we must do what we can to make sure that the health equity we seek and justice we seek is complete. How do we do that? What's the solution? Well, we need to move in the right direction of justice by moving on policy actions to address the systemic causes of addiction, which include poverty and a lack of access to health care. Tobacco use causes more than 480,000 deaths and an estimated $170 billion in healthcare costs each year. Tobacco companies and other manufacturers have taken advantage of lax FDA oversight to target our nation's youth, to flood the market with thousands of flavored e-cigarettes, and to continue to push their tobacco products in communities with lower incomes, lower levels of education, whether that be Native American people with behavior or those with behavioral health conditions, LGBTQ Americans, all of which also are disproportionately at rates higher in tobacco use, placing them at a greater risk for tobacco-caused diseases such as heart disease, cancer, and respiratory diseases. There's never been a more important time to stop the tobacco industry from targeting Black Americans and other groups, from preventing kids from using tobacco, and help more tobacco users quit. So what can we do? What's the take action here? What we can do to make a difference, we can support the immediate steps of the FDA, Congress, and state and local policymakers to stop this tobacco industry's predatory practices. One way is to end the sale of flavored tobacco products, including menthol cigarettes. Or really, I would say to end the sale of menthol cigarettes, including other tobacco products. The FDA has the authority to do this, but they've repeatedly failed to do so. So, as of last year at least, other policymakers have been stepping up. Share a little bit about that. In February 2020, in the 116th Congress in the U.S. House of Representatives, there was a bill, H.R. 2339. It was a bill by Congressman Representative Pallone, entitled Reversing the Youth Tobacco Epidemic Act. Actually, the whole title, that's the short title. The long title even makes more sense to all of us. It's Protecting American Lungs and Reversing the Youth Tobacco Epidemic Act. This act would prohibit all flavored tobacco products. And the Senate, you should know, they never took up that bill. That bill passed in February, almost a year ago. But the Senate and the 116th Congress never took it up. Our hope is that it will be taken up this year in the 117th Congress, and our hope is that the Senate would also take it up and pass it. Another bill that's out there that we support was to expand and promote coverage of tobacco cessation treatments. Representative Lisa Blunt Rochester and Senator Tom Carper both have introduced in their respective chambers the Quit Because of COVID-19 Act. That act would expand tobacco cessation coverage to all Medicaid beneficiaries during this COVID-19 public health emergency. But we're also working with them to alter that a bit, to make sure that even after COVID, after this COVID-19 pandemic passes, that there would be this availability to all within the Medicaid beneficiaries to expand tobacco cessation coverage. While COVID-19 is at the top of the agenda, we ask for your support to raise recognition for a serious public health problem that preceded the pandemic, tobacco use. It's been long the leading preventable cause of death in the United States. So with your support to reinvigorate the fight against tobacco use, you can join the fight for health equity and justice by supporting FDA actions to help reduce the death and disease that tobacco products cause. With your help in raising your voices to the FDA to support issuing a decision to grant the citizen petition calling for the prohibition of menthol as a characterizing flavor in cigarettes, you would be supporting countless lives born and unborn from the addiction to menthol cigarettes. And despite other pressing issues the FDA will be required to face with great urgency, we think it's critical that these decisions to remove flavored e-cigarettes and menthol cigarettes from the market is a foremost action. We welcome you to reach out to us, share your stories, speak with us, join the fight to save lives. We welcome you to go to the website and stay connected with us on social media. You see this page, we've got our partnerships at tfk.org if you want to just chat with us. And of course, our action alerts, we'd love to send you updates there. Please go to our website. We have the tfk.org/healthcare or health disparities function that we are really beginning to increase and to change and really motivate, putting a face on that, especially right now during Black History Month with African American and Black citizens of the U.S. We must do our part to stop the tobacco industry from targeting Black Americans. Other groups and kids with their combustible and non-combustible addictive products, we've got to do whatever we can. So please join in our effort and support these policies that will prohibit the pervasive marketing schemes and prohibit the sale of menthol cigarettes and save countless lives. Thank you.